All right, so our vaccine myth busters, starting with myth number one. This is for you, Dr. Moore. You cannot trust the vaccine because it was rushed.
Well, sure, it's an amazing accomplishment to have a vaccine made, designed in February and in people's arms in December. But look, it didn't come from nowhere. It came from decades of research and experience with the platforms that are being used. They were repurposed. They didn't come from nowhere. It's like, look, getting a new car. I mean, electric cars came in. Some people distrusted them. They were still cars. They were still based on a design that had been around for nearly 100 years. They just evolved.
All right. Moving on. Myth number two. This is for you, Dr. Kofer. The vaccine will give me COVID-19.
So that is a myth, and that's false. None of the authorized vaccines that are currently in the United States contain live virus that causes COVID-19. So that means it cannot, under any circumstances, make you sick with COVID-19.
All right. Myth number three, Dr. Moore. We don't know what's in these vaccines.
Well, sure, the public doesn't have access to the kind of information I do, although the New York Times, which isn't all that widely read, has published the full composition of the Pfizer vaccine as a list of chemicals. So the information is out there. We do know in the science community what is in these vaccines, but it's hard to explain to the public because you need a certain level of science, but it is known.
All right. Myth number four, Dr. Kofer. The vaccine can alter my DNA.
So that is also a myth. The COVID, I know people hear messenger RNA and they get a little scared, but they don't change or interact with your DNA in any way.
All right. Myth number five, Dr. Moore. I had COVID, so I don't need the vaccine.
Well, that might be true in some circumstances. You have a degree of immunity after getting COVID, and the more sick you were, the more immunity you have, and reinfections are rare. So you're probably fairly resistant, but you're also entitled to get the vaccine, and it will do you no harm if you do, and it will give you a boost. And there's an argument that you really perhaps only need one dose, but that's not tested yet.
All right. Myth number six, Dr. Kofer. Survival rate is so high that I don't need a vaccine.
So again, it's great that the survival rate is high, but there's also a bit of a Russian roulette that you're playing in terms of whether or not you're going to be in that survivor group. That's something we don't know until after the fact. And also, right now, if a lot of people get sick, it will overwhelm our healthcare system. And we're seeing that here in California. And I'd just like to remind people that COVID isn't the only thing that exists. We still have cancer. We still have car accidents. We still have, heart attacks and strokes and other things that people need healthcare for. And so if our ICUs and healthcare system are overwhelmed dealing with COVID, and you happen to have a stroke, or you happen to need, an emergency, appendectomy, we're now in trouble because we don't have the resources to be able to provide care to you.
Great. All right. Myth number seven, Dr. Moore. I won't have to wear a mask after I get the vaccine.
Well, that's a myth. As Dr. Kofer said earlier, firstly, you're not fully immune until a week or two after the second dose. So in that month or so, you absolutely do. And then it is not proven that you could not pass virus onto someone else. We know the vaccines prevent disease, but we don't know for sure yet whether they prevent asymptomatic infection in the circumstances where you can still pass the virus onto someone else. So absolutely behave as you have been doing before you get the vaccine.
All right, our last myth number 8, Dr. Kofer. The pandemic will be over soon, so I don't need a vaccine.
We have absolutely no clue how long this is going to lead on, but nothing that we're experiencing right now suggests that we are anywhere near the end of this. And so if that is one of the reasons that people are feeling,
the pandemic will be over soon, so I don't need a. Oh, sorry about that. Some weird feedback. Go ahead, Dr. Kofer.
So we simply don't know how long this is going to lead on, but we certainly don't have any evidence right now that it's ending anytime soon. So if someone is feeling like they don't need it because this will all blow over pretty quickly, I'm sure we all felt that way in March and April, that we're going to be back to it. And here we are in January, talking about what this year and maybe next year will look like. So that soon is relative, but I would say that's unlikely.